challenges. So let me start from the area of the progress that's being made. There is no one that would argue with the fact that United Nations has done an excellent job over the years supporting every part of the world, especially the African continent. So Diene, if I may, what are some of the most significant public health achievements and what has made it possible for your department, for your agency to be able to progress this?
Thank you so much. I'm so happy and honored to be here. Africa has made progress, and the health sector definitely for sure. And the most remarkable one will be maternal mortality. I think we have successfully reduced maternal mortality by 40%. Unfortunately, it doesn't mean that nobody is dying anymore. On the contrary, people are still dying. But that's one progress, if we're just talking about progress. I think the second progress on the health sector is really the health primary care, and that vaccines as well. I think we have made a great effort. And if I take vaccine, you take malaria, you take HIV as well, where progress has been made in Africa. But women are still dying while giving birth. So probably in this 80 years, what we need to look at, why is this still happening? Why is this still happening? Why women are still dying from preventable death? That's the most important thing.
So when we talk about women still dying of what is supposed to be preventable, we know that everything is not dependent on the United Nations, because the United Nations cannot take responsibility for the entire African continent. You're not collecting taxes from people who are living in that continent. So what's the work that is being done to encourage the government in Africa to invest more in the health of the people that they govern over? And the reason I'm saying this, as an African, I share the thoughts with a lot of people that if you want to make a nation wealthy, you have to improve on the quality of health care. So what is it that you're saying to the government around the continent?
That's a very good question. Let's take Africa as a whole, African Union. I think at the level of African Union, they have taken the right decision at every level. Now, for African governments, I say sometimes very brutally, probably some countries have not decided yet that the life of a woman is worth saving. And this is very serious, because maternal mortality, when you die from preventable maternal mortality, there is a problem, there is an issue. It's very often because you are alone at home and you have an old auntie say, no, you are too cautious, you can wait a little bit before going to the hospital. Or when you take the road, there is no road, simply, so you're not getting time. Or when you arrive at the hospital, nobody wants to take care of you because this is your first baby, and they believe that as well, you're just making scene. And when finally they want to take care of you, you bleed to death. So all that can be preventable. So for the government need to take that seriously. That, for me, is the first thing. And to tell the truth as well, sometimes people don't want to hear it. The best way to prevent maternal mortality is family planning. It's family planning. So to make sure that you can have the baby when you need to have it, when you desire to have it, when you're ready to have it. That's something as well that's very important. And I must say as well, we have champion countries on the continent who really, even when they receive donors' resources, they match those resources in their own domestic resources to make sure that they can provide family planning methods in the country. So for me, those who do not do that, those who do not accept that women's life will save the country, there is a very issue. And the last one on that is teen pregnancy, early marriage. And I often say, not the early marriage per se. Traditional Africa, girl will marry in big family, but they will be considered as family member, and nobody will touch them until the age appropriate to be wed. Now, you're married, you are young, and then you get pregnant. And early pregnancy is a killer. It's the #1 killer. And if you don't die, it's worse. You get the obstetric fistula. And then...
Okay, I know that just last night I had, last year actually, if I can take a few steps back. Last year, right on the stage, we had the First Lady of Sierra Leone, who has won a battle against the menfolk in Sierra Leone, insisting that early marriage is a criminal offense in Sierra Leone. Is there anything that United Nations can do in terms of advocacy to people in government and out of government to make sure that early marriage, which you have described as a killer, could become something that will be criminalized across the continent?
What I have described is not the early marriage, it's the early pregnancy, which goes very often together. You know, the UN, what we do is advocacy. We work closely. We are in every single country. We work with government. We work with communities, women-led organizations, youth-led organizations for that. But what we do is advocacy. It's educational advocacy. And to tell the truth, some governments are following. But what we do as well is to make sure that we have community leaders with us. Because the problem sometimes is your culture, your tradition, and you believe that's what is right. So working with religious leaders, community leaders, help us try to get to the last mile to ensure that we give the word that can save many, many lives and give the opportunity to women and young people to fulfill their potential.
Okay, so let's look, just before I move on to the issue of global funding that is diminishing very, very quickly and has serious implications for health on the continent of Africa. Share one or two good news, if you can find any, where community leaders have been able to do something that has led to a level of success. Because at News Central, we like to balance our stories with the good and the bad and the ugly in some cases. Is there any good news coming out of the continent that you can say, this is an example of one of them?
Absolutely. There are several good news. You know, we often talk about harmful practices, but we have best practices as well. And one of the good news, despite that the word took the word last year, is the FGM battle. FGM battle is a great success. Community leaders were really at the helm of really making sure that it's known that it's not religious-led, it's not nothing to religion, so it can decrease. This is something. The other thing that is very, very important as well in Africa today, we know that the median age for Africa for young people is 19-year-old or so. Well, young people are taking care of their own life now. Their employability, the way to create new jobs, the way to try to thrive in their community, it's something that gives hope to the continent. And as I said, maternal mortality is decreasing too. And some countries are really making effort to do so. We simply want that all countries be below the 100 deaths for, that would be something fantastic. But there are good things on the continent, thanks God, and we believe there will be more.
Okay, now let's talk about one of the things that may very, very quickly make your hope begin to fade away. And I don't mean just you, the hope for Africa. When it comes to the issue of donors, funds being pulled, United Nations receiving less money, which means your key men on the ground across the continent, they're being reduced and some of them are being pulled back or some of them are being laid off. That creates a serious issue. How do you cope with the cuts in the aids and how does it affect the health of the people across the continent?
That's a very big question. But UNFPA is a very resilient organization. We are a fund and a program. So we're used to mobilize our own resources. We go on every market there is there. Of course, government first, private sector, innovative source of funding, and individual giving. And we are operational. We work on the ground. We go to the last mile. So we don't stop and say we have no funds, so we don't work anymore. We use every cent we have. Now, what I would say, for me, I cannot stop and say there is no funding, so I don't work. What I'm saying is for government, what we do with government, because our focal point ministry in country is not the Minister of Health or the Minister of Family Affairs. It's the Minister of Economy and Planning. Because of the data, because of the macroeconomic data we care about. So we go to them and make sure that their service of the debt is very high. And how they can try to build on country remittances as well. You know, if they could lower the service of the debt and the country remittance for all the diaspora, that helps as well, you know, to save some domestic resources and invest in women's, young people's health and education. So for us, the funding cut is real, but we need to have, there is money on this planet today, but we need to build with what we have and keep on moving. We don't stop and cry, baby. No, we continue the job. That's what we're going to continue until we find the necessary funding. And there's money out there. We're going to find some.
Okay, yeah, you mentioned a word that just kind of like touched me a bit, because that's the word diaspora. I used to live in the diaspora, and News Central has a town hall meeting in a couple of days with Nigerians in diaspora here in New York.
Very good.
What will be a quick message that you would like someone like me, if you're not there, what will be the message you want to pass to the diasporan Africans, especially Nigerians?
Well, if I'm free, please invite me. But if I'm not there, please tell them to continue keeping investing in their brother and sister and in their mothers. Because Africa, if Africa may be about young people, people are aging. You know, when we talk about aging, Nigeria is one of the countries with Mauritius on the continent. So we need to build resilience. Tell them to invest in them. Tell them, you know, to build, wherever they are in the diaspora, a bridge with what they do in country. I know that's what I do with my son, you know, to bridge, not to forget and not to be discouraged by anything. That's their home country. They need to invest in it in every way possible. And probably the new way of investment, not the classical way. They are all done. We are done with that.
Okay, now let's move on to a global perspective on all of this. If Africa is going to end up being a sick continent, in a manner of speaking, what's the implication for the rest of the world? Because the world cannot afford to miss out on the talent, on the quality, on the human resources, on the human capital, on the potential and possibilities that the continent that is deemed as a young continent with incredible amounts of talented people, if it turns out being a sickly continent, what's the implication for the rest of the world?
My respectful advice to every leader is wake up, stand up, as the song will say, you know, because if we don't, the African young people will continue to thrive, whatever the difficulty. It will be two cases. We talk about migration, but hey, make no mistake. Either the Africa create a space for Africans to stay in Africa and to work, or the best among them will be taken abroad, wherever that is. That's a reality that the continent will face. So I truly believe that employability is important. We need to see what are the job for the future on the continent. How can you work? So for that, you need infrastructure. You need electricity. You know, if you don't have that, even going to school is a problem. So, you know, maternal health is my priority, data, but I need the infrastructure that allow the whole system to be working. That's what Africa needs so that the young people can thrive, sitting here in New York and having business in Abuja, or sitting in Bangkok and having business in Kurusa.
Okay, I've just been told that we've got just about a couple of minutes left. So let me ask this very quickly then. How can partnerships be a way forward? For me as a business leader, I always say that I'd rather deal with relationships rather than transactions.
Absolutely.
Transactions are quick, they bring you money, but they are not sustainable. So how can partnerships be the way forward for the continent, and who should be partnering with who?
Honestly, I think we are very great at partnership. We need to be greater at private sector partnership. Sometimes our processes are so cumbersome, so boring, that they leave us and run away from us. I think the UN after 80, it will be to ease all the way to work with everyone, every way possible, as long as it's accountable and we can trace every single dime.
Okay, my final question then, Diene. If you could urge one specific commitment from international partners during this UNGA week, what will that be? What will be the commitment that you will say every single person that's come to UN General Assembly high-level meeting, this is one thing that is absolutely essential. If we could do this, it's not a gold bullet, it's not a silver bullet, it's not any bullet, but at least it will have a profound impact on the health of the continent.
Believe in the UN. Without the UN, we cannot work the way we do. Everything you can do at your own hand, please do it selflessly.
Thank you ever so much. Thank you.
Thank you so much.